Chemotherapy drugs. A quick guidelines for nurses. What is chemotherapy? Chemotherapy is the use of powerful drugs to kill or stop the growth of cancer cells. These drugs target rapidly dividing cells, but they can affect healthy cells too, like those in the bone marrow, hair follicles, and digestive tract. How does chemotherapy work? Most chemo drugs interfere with cell division. Some block DNA replication, others prevent cells from completing mitosis. That's why different drugs are used together to attack cancer cells at various points in their life cycle. Major classes of chemo drugs. There are several key classes of chemo drugs. Alkylating agents, such as cyclophosphamide that damage DNA directly. Antimetabolites, like methotrexate and 5-FU, mimic cell building blocks to disrupt DNA synthesis. Plant alkaloids, such as vincristine, stop cells from dividing. Taxanes, such as paclitaxel, stabilize microtubules, freezing cells mid-division. Topoisomerase inhibitors, like doxorubicin, prevent DNA from unwinding. Each class has its own mechanism, timing, and toxicity profile. How are chemo drugs given? Chemotherapy can be given through various routes. Intravenous, IV, the most common. Oral, pills or capsules. Intrathecal, into the spinal fluid. Topical, for skin cancers. Intraperitoneal, into the abdominal cavity. The route depends on cancer type, location, and drug formulation. Common side effects of chemotherapy. Healthy fast-growing cells are also affected. Chemo can cause hair loss, nausea and vomiting, fatigue, bone marrow suppression, leading to anemia, neutropenia, thrombocytopenia, mucositis, inflammation of mouth and GI lining, neuropathy, tingling and numbness. Monitoring and patient education are key nursing roles. What should nurses know? As a nurse, you play a vital role. Safe handling. Use PPE when preparing or administering chemo. Patient monitoring. Watch for extravasation, allergic reactions, or toxicity. Supportive care. Manage side effects with meds like antiemetics and educate on infection prevention. Emotional support. Be a reassuring presence for patients during a tough journey. In our next video, we'll explore advanced treatments like targeted therapy and immunotherapy. Subscribe to Nursing Educare for more nursing knowledge.